So, I want you to just picture something for a second. You are walking down like a totally typical city street.
Right, just a normal day.
Yeah, exactly. You're holding a cup of coffee, maybe you're checking a text on your phone, and you step off a curb.
The completely mundane action.
Right. You've done it, I mean, 10,000 times.
Uh-huh.
But I really want to freeze frame that exact moment.
Okay, let's freeze it.
That exact millisecond.
Yeah.
Your heel strikes the asphalt right below the curb.
Uh-huh.
In your mind, your knee just did something very simple to get you down there.
It just bent and then it straightened.
Exactly, like opening and closing a cabinet door.
Yeah.
You think it's binary, it's clean, and frankly, it's just a complete fundamental illusion.
It really is, yeah.
Yeah.
I mean, it is the ultimate biomechanical lie that we tell ourselves.
The ultimate lie. Wow.
Yeah, because we look at our own legs swinging back and forth, and we naturally assume we're dealing with, like, basic carpentry.
Just a simple hinge.
Exactly, a basic hinge. But if you actually peer under the skin at the exact moment of that curb strike, it's wild. The reality of the physics, the geometry, and the sheer neurological panic happening in that joint, it completely defies those simple categories.
Which is really the core mission of our deep dive today. We are taking the entire architectural blueprint of what you think your joints are, and we're basically tearing it down to the studs.
It's a complete teardown.
Totally. And to do this, we are drawing from a truly phenomenal piece of source material. It's this deeply detailed, incredibly comprehensive presentation.
Right, by Dr. Christophe Delong and Keenjak's formation.
Yes, and it's titled Biomechanics and Neurology of the Knee. And what I love about this is how they frame the whole thing.
Oh, the psychological framework they use is so compelling. They do not look at the knee as just, a dumb physical bridge between two bones.
Right.
They frame it as the body's most vigilant joint.
Vigilant. See, that's interesting. Not intelligent.
No, actually, the presentation is quite specific about making that distinction.
Oh, really?
Yeah, the title of the most intelligent joint that rightfully belongs to the hand. Or maybe the shoulder, because it has this vast, super creative range of motion.
Right. I can move my shoulder in like a million directions.
Exactly. The knee just does not have that luxury. The knee is, well, in their own words, a vigilant slave.
A vigilant slave. I mean, that is a really heavy phrase to apply to a body part. Why do they characterize it like that?
Well, just look at its geographical position in the human body. The knee is entirely trapped.
Trapped between what?
It's this highly sophisticated, hypersensitive interface that is just caught between two incredibly demanding, basically dictatorial masters.
Okay, so who are the masters?
Above it, you have the hip joint. And the hip is this massive, multi-directional engine of sheer power and trajectory.
So the hip decides where the body's actually going.
Exactly. It dictates the overall movement. And then below the knee, you have the ankle.
Right, and what is the ankle doing?
The ankle is this obsessive micromanager. It's constantly dealing with the fine, unpredictable detail.
Like balance and terrain.
Right. Pebbles, uneven pavement, suddy dips in the ground. The ankle has to manage all of that chaos.
Oh, I see. So the knee is just sort of stuck in the middle management layer of that entire corporate structure.
That is a great way to put it. It basically has no agency of its own.
It just takes orders.
It just has to survive. It survives the brutal demands of the hip's power and the ankle's chaos at the exact same time.
All while supporting, like, the entire vertical weight of the human structure against gravity.
Exactly. So if you are listening to this right now, whether you're a weekend warrior who puts your body through the ringer, or maybe someone who just feels a weird, ominous click when you take the stairs.
Or even if you're just nursing an old sports injury from like a decade ago that still haunts you.
Right. This conversation is going to explain the actual reality of your own body. We are going to unpack the forces acting on your cartilage.
And more importantly, how your brain is secretly pulling the strings of every single step you take.
And to really start that unpacking, we have to go right back to that curb strike you mentioned and completely dismantle the hinge myth.
Let's do it.
The text establishes immediately that the knee is not a simple hinge. In biomechanical terms, it is a trochleogynglymus joint.
Okay, hold on. Trochleogynglymus.
I know, it's a mouthful.
I feel like I need a medical dictionary just to pronounce that. Break down what that actually means for, a normal person just trying to get out of a chair.
Sure, yeah. So a standard hinge, like on a door, has a single fixed stationary pin.
Right, it just swings on that one pivot.
Exactly, it rotates around one dot in space. But a trochleogen limas joint means it has an evolving, instantaneous center of rotation.
Wait, the pivot point itself is actually moving?
Yes, the actual mathematical pivot point moves around as the leg bends.
How does a joint even stay together if the center of it just keeps shifting around?
It absolutely has to shift, mostly because of the sheer violence of human movement. Yeah, Dr. DeLong's material means that during a normal, relaxed walk like just a stroll down the sidewalk, the knee handles loads of 3 to 4 times your body weight.
Let me stop you right there. 3 to 4 times.
Yes.
So if I weigh 150 pounds, my knee is absorbing, 450 to 600 pounds of force just by taking a walk.
On every single step you take.
That's insane.
And when you jump or run or, bound off that curb, that load spikes to a massive 8 times your body weight.
But bone is biological, it's living tissue. 8 times my body weight is 1,200 pounds.
It's a massive amount of force.
If I drop a 1,200-pound safe onto a piece of biological material the size of a fist, it should just turn to dust. It should completely shatter.
And if it were a perfect simple hinge, it would shatter instantly. The force would just be way too concentrated.
So how does it survive?
To dissipate that catastrophic load, the geometry of the bones themselves has to be completely irregular.
Irregular how?
Well, they cannot be perfectly round or symmetrical. The ends of your thigh bone, the femur, have these 2 rounded knobs at the bottom called the condyles.
Okay, I'm looking at the diagrams from the presentation right now, and they really don't look like a matching pair.
They are far from it. The presentation makes it very clear. They are highly asymmetrical.
Which one is which?
So the medial condyle, that's the one on the inside of your leg, closest to your other knee, is longer, it's physically narrower, and it has a very distinct, sharp curvature.
Okay, and the other one?
The lateral condyle on the outside of the leg is shorter, and its curve is much, much flatter.
So they don't match at all?
Not at all. And furthermore, the radius of the curve on both of these actually decreases as you move from a straight leg into a bent leg.
Wait, so it's not even a circle?
No, it's actually a geometric spiral.
Okay, so you have this totally asymmetrical spiral resting on top of the flat shin bone.
Exactly.
Because of that weird lopsided shape, the joint simply can't swing open and close like a cabinet door. It would bind up, right?
It would completely lock up.
So what does it actually do when I bend my leg?
It performs this really highly choreographed mechanical dance.
The dance.
Yeah, the text describes this as a complex mixture of rolling and gliding. It's the famous rollback mechanism.
Rollback mechanism. Okay, explain that.
Imagine your leg is perfectly straight. That is 0 degrees of flexion.
Got it.
From 0 degrees to about 20 degrees of bend, the bones are purely rolling against each other.
Like a wheel rolling down the street.
Correct, pure rotation. But here is the critical problem.
Yeah.
If the femur only rolled like a perfect wheel as you bend your knee deeper, say towards 90 degrees or like a full squat, that wheel would literally roll right off the back edge of the shin bone.
Oh, wow.
Yeah, dislocation would be inevitable. The bone would just fall off the back of the cliff.
So it has to somehow stop rolling or pull itself back.
Exactly.
Like, okay, let me try to visualize this. It's not a wheel on a street. What if it's like a car tire stuck in a ditch? Or no, wait, like a car tire spinning in a mud puddle?
Oh, that's good.
It's rotating forward, trying to generate movement, but because it's slipping in the mud, it's sliding backward at the exact same time, which means the car itself stays perfectly centered right over the puddle.
That is an excellent visualization, yeah. To achieve up to 140 degrees of maximum deep flexion like when a baseball catcher squats behind home plate.
Right.
The bottom of the thigh bone has to spin like a tire, but it also has to simultaneously glide backward across the plateau of the tibia.
So spinning and sliding at the same time.
Exactly. The spin in the mud keeps the heavy bones safely centered over each other instead of just rolling off the cliff.
Okay, but what exactly is causing the slip in the mud? Bone doesn't just move on its own.
That's the cool part. The physical conductor of this backward glide is a ligament hiding in the back of the knee.
Okay.
It's called the posterior cruciate ligament, or PCL.
The PCL.
The PCL acts exactly like a tether.
Yeah.
As the bone rolls, the tether gets tight and physically yanks the femur backward.
Oh, I see.
And this not only prevents a catastrophic collision of bone, but it dramatically changes the angle of the joint.
Which does what exactly?
It drastically increases the mechanical leverage for your massive thigh muscles to lift you back up.
That is just an absolute masterstroke of architectural genius.
It really is.
It solves the geometry problem and the strength problem at the exact same time.
Beautifully.
But the geometry gets even wilder when we do the exact opposite motion, doesn't it? When we straighten the leg out.
Oh, yeah. The screw-home mechanism.
Right. The text refers to this as the screw-home mechanism. And I want everyone listening, you are sitting down right now and you are able to just slowly straighten your leg out in front of you until it locks.
Try to feel it.
Yeah. Pay attention to what happens in the very last inch of movement. What's going on there?
That last inch is what the text calls the magical final 20 degrees of terminal extension.
Terminal extension, okay.
This is where that asymmetrical bone shape we talked about really shines.
For mismatched condyles.
Right. Remember how we said the medial condyle, the inner knob, is physically longer than the outer one?
Right. It's longer and narrower.
Well, because it's longer, its rotational track is longer. So as you straighten your leg, the outer condyle finishes its path first and just stops.
It hits the end of its track.
It hits a wall. But the inner condyle still has more track to cover. It has to keep moving forward.
Oh, I see. It's like if two people are running a race on a curved track, but they are holding a solid pole between them.
Good analogy.
If the outside runner stops, but the inside runner just keeps sprinting forward, the pole is going to violently swing around in a circle.
Precisely. Because the two condyles are connected as one solid piece of bone, when that inner condyle forces its way forward to finish its longer path, it wrenches the entire thigh bone inward.
It twists it.
It forces an automatic mechanical twist. It screws the knee home. It locks it entirely passively.
Wow, I can actually feel that if I put my hand on my knee right now and lock it straight. The whole thigh bone subtly twists inward.
You can feel the mechanics working.
And the evolutionary benefit of this is, I mean, it's astronomical for us as human beings, isn't it? Because once the knee clicks into that screwed home locked position, you don't even need to fire your muscles to keep your leg straight.
Exactly. It allows human beings to be bipedal in a highly, highly energy efficient way.
We could just stand there.
We can stand upright for hours, gazing out over a landscape or, just standing in a long line at the grocery store with almost zero muscular energy expenditure in the legs.
Because the bones just stack and lock on their own geometry.
Exactly.
It's incredible adaptation.
Yeah.
But here's sort of the elephant in the room.
Okay.
As magnificent as this bone geometry is, bones are essentially just dumb scaffolding.
Right. Pretty much.
They're completely inert. They don't have motors to handle 8 times the body's weight in a jump while managing this precarious rolling, gliding, spinning, tire in the mud, twisting lock system.
It's a lot to manage.
Something soft and pliable has to strap that whole explosive package together.
Which transitions us perfectly from the bones to the actual bodyguards of the joint, the soft tissues.
The body yards, I like that.
A massive portion of Dr. Delong and Kim Formation's presentation focuses specifically on the ligaments and the menisci.
Okay.
These are the unsung heroes holding the architecture intact.
So let's start with the one that literally every sports fan dreads hearing about on a Sunday afternoon.
The ACL.
Right. The anterior cruciate ligament, the ACL. Looking at the clinical data here, it's remarkably small for the reputation it has.
It is tiny.
The text says it's just 3 centimeters long. That's, what, barely over an inch?
Barely over an inch, and it sits dead in the center of the knee joint.
Wow.
Yet, despite its tiny size, it provides a staggering 85% of the total holding force that prevents your flat shin bone from violently sliding forward right out from under your thigh bone when you plant your foot.
85%. From a 1-inch little band.
Yes.
And it does this by just being a single thick cable.
Actually, no. It is bifascicular.
Bifascicular, meaning 2.
It is composed of 2 distinct bundles twisted around each other.
Oh, interesting.
You have the anteromedial bundle, which gets pulled tight when the knee is bent, providing stability during flexion.
Okay.
And then you have the posterolateral bundle, which tightens when the leg is straight to stop the joint from twisting rotationally.
I feel like in pop culture, we always hear the ACL talked about like a rope, like a mechanical bungee cord tying 2 rocks together.
That's the common misconception, yeah.
But the presentation explicitly states something mind-blowing. The ACL is not just a rope. It is a highly sophisticated sensory organ.
This is an absolute fundamental paradigm shift in how we view orthopedics.
Sensory organ, like an eye or an ear.
Well, the ACL is packed with microscopic neural sensors. Specifically, the text highlights Ruffini and Pacini mechanoreceptors.
Okay, I have to pause you right there. Ruffini and Pacini mechanoreceptors.
It's a lot of jargon, I know.
I have literally never heard those terms before in my life. Break that down for me like I'm 5. Are these sensing pain? Are they sensing heat? What are they doing inside a ligament?
They are essentially physical deformation sensors.
Deformation.
Right. So the Ruffini corpuscles are slow-adapting sensors that are completely interwoven into the collagen fibers of the ligament itself.
Okay, so they're built into the rope.
Yes. When you step and a bone's shift, the collagen naturally stretches. That physical stretch deforms the Ruffini corpuscle, which opens up ion channels and fires an electrical signal straight to your brain.
Saying what?
Saying, hey, the joint is stretching exactly this much and at this specific angle.
Oh, wow.
And then the Pacini corpuscles are fast adapting. They detect rapid acceleration or deceleration.
Speed sensors.
Exactly. They tell the brain the joint is moving really fast right now.
So they're basically an internal telemetry system, streaming real-time 3D spatial data directly to the central nervous system.
Thousands of times a second. Yes.
But wait, if the ACL is full of these telemetry sensors, then tearing an ACL isn't just snapping a bungee cord.
Not at all.
It's violently cutting the alarm system to the brain.
You've hit on the exact clinical tragedy of an ACL tear. The medical term the text uses for this is defermentation.
Defermentation.
When the ACL snaps, the physical rope breaks, yes. But more importantly, the knee essentially goes dark. It goes completely blind. The brain is suddenly cut off from its primary source of microsecond updates about where that joint actually is in physical space.
So that completely explains the psychological terror I've seen in friends who have torn their ACLs.
It's very common.
It's not just that their leg hurts, it's that they literally don't trust the leg anymore.
Yeah.
Even a year later, when their muscles are huge again, they look terrified to jump.
Because without that sensory data, they experience profound micro-instability.
Micro-instability.
Yeah, even if they have massive bodybuilder-level leg muscles, their knee will randomly give out on them when they just step off a curb.
Why, if the muscle is there?
Because the muscle is just an engine, the brain is the driver.
Right.
If the driver is blindfolded because the ACL sensors are dead, it doesn't know when to fire those massive muscles to catch the joint. The muscle fires a fraction of a second too late, and the knee just collapses.
The muscle is there, the strength is there, but the communication wire has been completely slashed.
Exactly.
That is frankly terrifying. Now, alongside the ACL right in the center of the knee, we have these two other pieces of soft tissue acting as shock absorbers.
The menisci.
The menisci. And just like the weird asymmetrical bones we talked about, the menisci are also completely lopsided.
They are the ultimate interfaces of mechanical data. You have the medial meniscus on the inside of the knee.
Okay, medial on the inside.
It is shaped like a C. It is quite large, and crucially, it is rigid.
Rigid.
Yes, it is physically anchored down to the collateral ligament on the side of your knee.
Which, if I'm thinking about physics here, makes it a bit of a sitting duck.
Exactly.
If it's bolted to the floor, it can't move.
Because it is tethered down, it has virtually zero mobility. When a sudden, brutal rotational force hits the knee, say like a football player getting tackled hard from the side, the medial meniscus literally cannot run away from the danger.
It's stuck.
It is trapped between the grinding bones, which is exactly why it is so frequently crushed or torn in sports.
Man. And then on the outside of the knee, the lateral meniscus is a totally different story.
Completely different. It's shaped almost like a closed circle, like an O. It's thicker, and it is highly, highly mobile.
Mobile? How mobile?
The text notes that during deep knee flexion, the lateral meniscus can slide backward up to 12 millimeters.
12 millimeters. That's almost half an inch of movement.
Which is absolutely massive inside a tight joint. It physically slides out of the way of the rolling bone to avoid getting crushed.
That's amazing.
This mobility is life-saving for the tissue, but their true magic, the real reason they are so critical to human walking, lies in their mechanical function.
Okay.
The sources dwell heavily on this concept of hoop stress.
Hoop stress. I tried to wrap my head around this when I was reading the material. I kept thinking of, like, a sponge.
A sponge!
Yeah, like if I put a heavy weight on a wet sponge, the sponge compresses vertically and absorbs the shock.
Is that what the ministers are doing?
A sponge is a good starting point, but it's not entirely accurate.
Okay, why not?
A sponge just compresses and flattens out. The menisci do something far more sophisticated. Let's go back to the shape of the bones.
The asymmetrical knobs.
Right. You have the...
It would be utterly destructive. So the menisci sit between the sphere and the table, like two little semicircular wedges.
like little cups.
Yes, they cup the rounded femur, increasing the surface area of contact. But more importantly, they're shaped like wedge rings.
Wedge rings.
When the vertical, downward crushing weight of the body hits them, their specific shape forces that energy to expand outward, horizontally.
Ah, I see. It's like stepping on a tight rubber ring.
Exactly.
The downward step forces the ring to stretch outward.
Yes, they transform a vertical downward crush into a horizontal outward stretch.
And that is hoop stress.
That is hoop stress. They are taking the gravity that is trying to destroy your shin bone, and they are dissipating it sideways into their own tough circular fibers.
That is just gorgeous physics. They are translating gravity into horizontal tension just to save the bone.
It really is elegant.
And Dr. Delong's data notes they absorb 50 to 70% of the total shock passing through the leg.
Which means without them, the entire system fails rapidly. And this brings us to a really profound realization.
Which is?
If the menisci are expertly managing the physics of gravity, and the ACL is expertly managing the sensory data of position,
Right.
then the knee is definitely not a passive hinge. It is an active communication hub talking directly to the brain.
Which perfectly tees up, honestly, the most mind-bending layer of this entire presentation. The neurology.
Oh, the neurology is fascinating.
How the brain actually manages all this data. Let's talk about the neurological command center.
Well, we have to understand that the knee is neuromanaged by a complex alliance of 3 distinct brain centers.
3 of them.
First, you have the primary motor cortex. This is your conscious, voluntary control. It modulates the fine details of muscular force when you consciously decide, hey, I'm going to step over this puddle, or I am going to kick this ball.
Right, the conscious pilot, the part of me that is actively thinking and making decisions.
Exactly. Then you have the cerebellum.
The cerebellum.
The cerebellum is the subconscious biomechanical predictor.
Oh, so what does that mean?
It holds an internal, highly complex mathematical model of what your movement should look like. As you move, it constantly compares that perfect model to the messy, real-time sensory data coming up from your ACL's Ruffini corpuscles.
Oh, wow.
And if there's a discrepancy, say your heel hits a patch of ice and slips, the cerebellum calculates the error and executes a muscular correction in 10 to 20 milliseconds.
Let's just pause on that number for a second.
Yeah.
10 to 20 milliseconds.
It's fast.
A millisecond is 1,000th of a second. That is incomprehensibly fast. I mean, I blinked my eye in like 300 milliseconds.
It has to be that fast because gravity acts instantly.
Right.
But the cerebellum can't do it all alone. The third brain center involved is the basal ganglia.
The basal ganglia.
Think of the basal ganglia as your hard drive. It stores your automated stabilization routines.
So muscle memory.
Essentially, yes. As you become an expert in a movement over years, whether it's walking, skiing, or dancing, the basal ganglia takes over the routine. It reduces the cognitive cost, so your conscious primary motor cortex can think about other things, like having a conversation while you walk.
Okay, so you have the pilot steering, the predictor fixing the turbulence, and the autopilot running the engines, all working together just to keep this bone spinning in the mud.
That's a perfect summary.
But the speed of this communication is critical, isn't it? The text mentions a few different speeds.
Yes, latency is key.
It says a command from the brain to the muscle, the corticomuscular latency, takes about 40 to 60 milliseconds.
Right.
But a pure reflex arc happens in under 50 milliseconds. What is the tangible difference between those two?
The difference is literally life and death for the joint.
Really?
The corticomuscular latency, that 40 to 60 milliseconds, is the time it takes for a signal to go all the way up to your brain, get processed by the cortex, and travel all the way back down your spine to your thigh to fire a muscle.
It's a long round trip.
But a reflex arc, the one under 50 milliseconds, is a distress signal. It shoots straight from the stretching ACL, hits the spinal cord, and immediately bounces right back to the hamstring muscle to brace for impact.
So it skips the brain entirely.
Completely bypasses the processing of the brain.
It's an emergency override switch.
Exactly. And that tiny 10 millisecond difference is often the difference between a slight wobble and a catastrophic ligament rupture.
Unbelievable.
And when those electrical signals finally do arrive at the knee, they have to orchestrate a massive, incredibly complex network of muscles.
Which muscles?
You have the quadriceps on the front of the thigh and the hamstrings on the back.
And the text is very clear that these aren't just like blocks of dumb meat pulling on bones. They are a highly tuned synergistic system. The quads are actually 4 distinct muscle heads.
Yes.
And the presentation highlights one of them as the absolute most important for knee health, the vast medial.
Ah, the vast medial.
The inner thigh muscle right above the knee, shaped sort of like a teardrop.
The vast medial is absolutely crucial. It is the great stabilizer.
What does it do?
When you do a deep lunge, That single specific muscle head is responsible for 80 to 85% of the muscular activation required to keep everything centered and tracking properly.
85% from one muscle head.
And then pulling in the exact opposite direction of the quads, you have the hamstrings.
Right.
Dr. Delong calls the hamstrings the ultimate protectors of the ACL.
Okay, I really want to understand the mechanics here. Why are the muscles on the back of my leg protecting a tiny ligament deep inside my knee?
Because of the direction of their physical pull.
Okay.
Remember, the ACL's primary job is to stop the shin bone from sliding forward out of the joint.
Right, it holds it back.
Well, the hamstrings are attached to the back of the shin bone. When you contract your hamstrings, they physically pull the shin bone backward.
Oh.
By doing so, they completely unload the physical tension on the ACL. They're literally doing the ligament's job for it.
That makes perfect sense.
The presentation notes that for optimal, injury-free joint stability, the strength ratio between your massive quadriceps pulling forward and your hamstrings pulling backward should be precisely 1.5 to 1.
1.5 to 1. So if your quads are massively overdeveloped compared to your hamstrings, they will just overpower the joint and shear the ACL right off the bone.
Precisely. It's an incredibly delicate tug-of-war.
And speaking of delicate, there's one more little muscle hiding deep in the back of the knee that caught my eye. The popliteus.
Oh, I love the popliteus.
The text literally refers to it as the key to the knee.
It's a wonderful, tiny little structure. Think back to the screw-home mechanism we discussed earlier.
Right, how the knee violently twists inward to passively lock straight when you stand up.
Exactly, the energy-saving lock. Well, when you want to walk again, you can't just forcefully bend a locked bone. You would break it.
Oh, right, it's locked.
You need a key to unlock the door first. The popliteus muscle is that key.
What does it do?
Its only real mechanical job is to fire for a fraction of a second to initiate a tiny millimeter-sized outward rotation of the shin bone.
So it just untwists it.
It untwists the lock so the massive hamstrings can safely take over and bend the knee.
It's literally a tiny key unlocking a massive vault door.
It's an entire universe of micromechanics in there.
It really is. But the true hallmark of an elite mover, at least according to the Kinexa formation material, isn't actually about how strong these muscles are.
No, it's not.
It isn't even about how fast your reflexes are. It is a neurological phenomenon called feed-forward expertise.
This concept completely forces us to reevaluate what we think stability actually is.
How so?
We naturally tend to think of stability as a fast reaction to a disruption. You know, you trip on a rug, your body senses the fall, and your muscles fire rapidly to catch you.
Right, that's what I always thought.
That is reaction. But the text argues that relying on reaction means you are, by biological definition, arriving late to the accident.
Arriving late.
The damage might already be done in the milliseconds it takes your muscles to fire.
So, wait, true stability isn't about reacting fast. It's about your brain predicting the impact before the impact even happens.
Exactly.
Yeah.
That is feed-forward control.
It's like, okay, if I'm flying on a plane, reaction is the pilot feeling the plane shaking, looking at the instruments, and then trying to level out the wings.
Right.
Feed forward is the pilot looking at the weather radar, seeing a storm cloud 2 miles ahead, and bracing the plane and tightening the seatbelts before the first drop of rain even hits the windshield.
That is a perfect analogy. In a highly trained individual, the brain uses visual data, spatial awareness, and past experience to predict the exact physical force of the upcoming foot landing.
Before it lands.
Yes. The motor cortex sends the electrical order for muscular co-contraction, meaning it fires both the quadriceps and the hamstring simultaneously to create a rigid muscular cast around the joint before the foot even makes contact with the ground.
The defense system is fully deployed before the enemy even knocks on the door.
Exactly.
The knee lands, already prepared to absorb the specific weight of that exact step.
Yes. And the profound tragedy of knee injuries is what actually happens to this beautiful, predictive neurological system when the physical hardware breaks down.
Oh, right.
The text details a heartbreaking clinical reality called arthrogenic muscle inhibition.
I found this part so incredibly tragic, almost in an emotional sense.
It is.
I had a friend who tore his ACL playing basketball. He had surgery. 2 weeks later, I looked at his leg, and his quadricep, this huge muscle, looked like a deflated water balloon.
Just melted away.
It was entirely gone. I honestly thought he was just babying it. Or maybe it was because he was in a brace and not working out.
That is what almost every patient assumes. They think it's just simple disuse atrophy from lying on the couch.
But it's not.
But it's not. It is an active, deliberate chemical sabotage by your own brain.
An active sabotage.
Yes. When a knee is injured, a torn ACL, a smashed meniscus, the brain is suddenly flooded with chaotic, painful, completely distorted sensory data from those ruptured ruffini corpuscles.
The alarm bells are ringing constantly.
Exactly. The central nervous system essentially becomes terrified of the joint. It does not trust the data it's getting.
Wow.
So, to protect the body from attempting a movement that could cause further catastrophic damage, the brain literally cuts the power to the quadriceps.
It unplugs the machine.
It chemically and neurologically inhibits the alpha motor neurons that fire the muscle. You can try with all your conscious willpower to flex your quad, and your brain will actively block the signal.
That's wild.
The muscle melts away rapidly, not from lack of use, but because the brain has thrown the circuit breaker to prevent the knee from moving.
The vigilant slave is put in chains by its own master for its own protection.
That's a poetic way to say it, yeah.
That is just staggering. And, to truly appreciate the sheer physical power that the brain is so terrified of that it actually has to shut down the quads, we have to look at the tiny, bizarre piece of bone that makes all that psi power possible in the first place.
Ah, the patella.
This brings us to the kneecap. The patella.
The kneecap is a true marvel of evolutionary engineering. Clinically, it's known as a sesamoid bone.
A sesamoid bone. If I remember my anatomy trivia correctly, that means it is a bone that just floats.
Yes, it just floats. Unlike almost every other bone in your body, it is not physically bolted to another bone with rigid ligaments.
So where does it live?
It is entirely encased within the tendon of the quadriceps muscle. It floats right over the front of the joint, acting as a physical spacer.
The spacer.
It pushes the quadriceps tendon up and away from the knee's center of rotation.
Okay, let's unpack why that matters. I'm trying to picture the mechanics here.
Sure.
If the quad is on my thigh and it wants to lift my heavy lower leg, it has to pull on the shin bone. But the knee joint is right in the middle, acting as a pivot point.
Right.
If I understand this correctly, the kneecap is basically a pulley system.
Exactly like a pulley. Imagine trying to open a very heavy, solid wooden door.
Okay.
If you push on the door right next to the hinges, it requires massive effort. You have absolutely no leverage.
Right. It's super hard to push.
But if you move your hand to the outer edge of the door where the doorknob is, it opens easily.
Because you have leverage.
Exactly. By physically pushing the tendon out and away from the hinge point, the patella dramatically increases the mechanical lever arm of the quadriceps muscle.
And it doesn't just increase it a little bit.
No.
The text states that the mere presence of this little floating bone increases the efficiency of your quadriceps by a massive 30 to 50%.
Without it, doing a simple lunge to pick a pen off the floor, or even just getting your body weight up out of a deep couch would be biologically exhausting,
Wow.
if not completely impossible. Your thigh muscle would literally have to be twice as large just to generate the exact same force.
But because this bone is floating inside a tendon, unanchored, it presents a pretty massive mechanical vulnerability, right?
It does.
If it's a pulley, it has to stay on the track. The text highlights how crucial patellar tracking is.
Tracking is everything. On the front of your thigh bone, there is a physical groove called the trochlea. The back of the kneecap is shaped like a wedge that fits perfectly into that groove. As you bend your knee, the patella glides down the groove.
Like a train on tracks.
Exactly. But because it floats, its ability to stay centered in that groove depends entirely on a neurological tug of war.
Between the muscles pulling on it.
Yes. You have the inner quad, the vas medial we talked about earlier, pulling the kneecap inward.
Right.
And you have the outer quad, the vas lateral, pulling it outward. If this muscular balance is off by even a microscopic fraction,
Like if one fires late.
if your brain fires the outside muscle just 1 millisecond faster than the inside muscle, the patella gets pulled slightly off track. It derails.
And when a bone derails under load, it grinds.
It grinds brutally against the edge of the bony groove, creating intense friction. This manifests clinically as patellar syndrome.
Ouch. And to survive that incredible friction of a lifetime of movement, the patella is heavily armored.
Extremely heavily armored.
The sources reveal this mind-blowing anatomical fact. The backside of the kneecap boasts the single thickest layer of cartilage in the entire human body.
Can be up to 7 millimeters thick in a healthy adult.
7 millimeters.
Nowhere else in the human body requires that level of biological cushioning.
And the reason it needs a quarter-inch of solid armor is just because of the sheer physics of being a bipedal human walking in a modern world.
Exactly.
The text states that just the simple act of walking down a flight of stairs places a pressure equivalent to 7 times your body weight directly onto the back of that tiny floating bone.
7 times. Just think about that the next time you walk down into a subway station.
That's terrifying.
Every time your front foot hits a step and your back leg bends to lower you down, 7 times your body weight is being funneled through a surface area roughly the size of a large coin.
Wow.
The quadriceps are pulling up, gravity is pulling down, and the kneecap is being violently crushed into the thigh bone right in the middle.
It is a high-wire act of extreme physics that we just take entirely for granted. Until, that 7 millimeter layer of cartilage begins to wear thin.
Which brings us to a somewhat sobering part of our deep dive.
Yeah, it's time to face the music.
With the mechanical hinge debunked, the soft tissue bodyguards introduced, the neurological autopilot explained, and the kneecap pulley laid out.
We need to look at the life cycle of this entire system.
Yes.
What happens over decades? What happens when the vigilant slave starts to fail? Dr. Delong introduces a concept that is both deeply clinical and deeply philosophical, the hierarchy of decay and the capital of life.
It is a stark, very unsentimental look at human aging. Dr. Delong's text presents a very clear clinical hierarchy of the knee structures, the cartilage, the menisci, and the ACL.
Okay.
And it defines cartilage right at the very top of this hierarchy as the absolute capital of life of the joint.
Capital of life, meaning like money in a trust fund. Once you spend it, you are broke. You cannot earn it back.
Precisely. Cartilage is avascular.
Meaning
It has no blood supply. Because it has no blood supply, it has no immune response and no cellular repair mechanism whatsoever.
oh, wow.
Therefore, it is the only element in this entire complex system that never regenerates. Once a microscopic millimeter of cartilage is worn away by friction, it is gone forever.
Forever.
When it's entirely gone, you are left with the exposed nerves of the bone grating directly on the exposed nerves of the other bone. The text literally calls this the end of game for the natural knee.
Checkmate. Total knee replacement is your only option.
Yes. Now, beneath the cartilage, in this hierarchy of importance, you have the menisci. The text frames them as the bodyguard.
Right, the hoop stress shock absorbers we talked about earlier.
Exactly. Their entire biological purpose, their only job, is to serve and protect the cartilage.
Okay.
If you lose a meniscus, whether a surgeon removes a torn piece or it just disintegrates from age, the text states that the downward pressure on the cartilage multiplies by 2 to 3 times instantly.
2 to 3 times. Okay, so let me see if I can synthesize this into a metaphor.
Let's hear it.
Let's see. If the knee is a VIP motorcade,
Okay.
the cartilage is the president in the armored car. The menisci are the Secret Service agents walking alongside the car.
I like this.
And the ACL. What is the ACL?
The text calls the ACL the geometry guardian. It keeps the bones aligned so the shock absorbers can actually work.
Okay, so the ACL is the driver of the car. It keeps the motorcade on the road.
Yes.
If the driver gets shot, if the ACL tears, the car swerves out of control. It crashes into the Secret Service agents, crushing the menisci.
Right.
And once the agents are dead, the assassins, which are gravity and friction, have a clear, totally unimpeded shot at the president, the cartilage.
That is a remarkably dark but perfectly accurate analogy.
It's grim.
The timeline is ruthless. The text notes that losing a meniscus essentially guarantees the onset of severe bone-on-bone arthritis within 10 to 15 years.
Wow.
It is a mathematical certainty. The derailments obliterate the life capital.
This brings up a really fascinating temporal paradox in the text. It compares a knee injury at age 20 versus a knee injury at age 50. The math of the tragedy changes completely based on your age.
It does. At age 20, the ACL is the most critically important structure for a surgeon to protect and reconstruct.
Why the ACL at 20?
Because a 20-year-old has 60 years of life left. If you tear your ACL at 20 and don't fix it, the tragedy isn't the torn ligament.
What is it?
The true tragedy is the resulting micro-instability. That tiny millimeter wobble in the joint, repeated over millions of steps over the next 2 decades, will slowly assassinate the menisci and the cartilage.
So by 40, your joint will be destroyed.
Exactly.
But if I am 50 years old, The math is different.
At age 50, the cartilage becomes the most precious structure, not the ACL.
Why?
Because you can actually live without an ACL if you have to.
Really?
Yes. You can train your brain's feed-forward mechanism to compensate. You can build massive hamstring muscles to pull the shin back and do the ACL's job. You can even live with a partially torn meniscus.
But you can't live without the cartilage.
You absolutely cannot survive the total loss of cartilage.
So if you are in your 40s or 50s listening to this right now, your paradigm of physical fitness needs to completely shift.
Absolutely.
The game is no longer about building explosive, chaotic strength like a teenager playing tackle football. It is entirely a conservation mission.
Protect the life capital.
You must protect the present at all costs. You must protect the cartilage.
Conservation becomes the ultimate metric of health.
Which naturally leads to the question, how do our different human activities impact this conservation mission? Does a football player's knee age differently than a skier's knee or a dancer's knee?
They absolutely do. And Section 6, or rather the final phase of Dr. Delong's presentation, provides a brilliant comparative typology of athletic knees.
I found this part so interesting.
He categorizes them by their dominant functional qualities: force, reactivity, continuity, and exactness.
I really want to dive deep into the how of these. Let's start with the bruiser, the rugby knee.
The dominant quality of the rugby knee is tolerance to chaos. This is a joint subjected to extreme, unpredictable, multi-directional impacts from tackles and scrums. To survive this, the body adapts by building massive muscle armor, specifically focusing on eccentric muscle strength.
Eccentric strength, meaning the muscle's ability to absorb force while it is actively lengthening, like the downward phase of a heavy squat.
Yes, exactly. It acts as a massive braking system. Furthermore, the physical ligaments inside the knee actually adapt to the trauma by thickening.
Oh, they get thicker.
They hypertrophy to resemble thick, dense rope.
So it's heavily armored, like driving a tank through a minefield. It survives the explosions just by being thick.
But the text notes a critical, fatal limitation to the tank strategy.
Which is?
When deep neurological fatigue sets in late in a match, when the brain is exhausted and the glycogen is depleted, the muscles stop firing fast enough.
The latency drops.
The co-contraction latency drops, the armor falls away, and because the sheer forces of a 250-pound man running are so high, the thickened ACL simply ruptures late in the event.
It snaps.
It's a robust knee, but biologically very costly to maintain long term.
Makes sense. Next up, we have the soccer knee, the global game. How does this differ from rugby?
The dominant quality here is not chaos, but reactivity.
Reactivity.
Soccer requires lightning-fast pivots, single-leg balancing while kicking, and explosive directional changes on turf. The soccer knee operates like a high-speed emergency sensor network.
So it's fast.
Very fast. It develops incredible rapid-fire hamstring pre-activation to protect the joint during the violent snapping motion of a kick.
It sounds highly performant. What is the downside?
The downside is the silent killer. A soccer player isn't usually destroyed by one massive tackle.
Well,
They are destroyed by the constant repetitive microtraumas. Thousands of high-speed twisting and planting motions slowly shear away the meniscus and silently grind down the cartilage over a decade. It is a highly reactive knee, but ultimately fragile to the passage of time.
okay, now let's leave the field and hit the slopes. The skier knee. Skiing is notorious for blown knees. Why?
The skier's knee is defined by continuity of load.
Continuity.
A skier holds long, deep, isometric squats while hurtling down a mountain. An isometric hold means the muscle is firing maximally, but the joint angle isn't changing.
Right.
The knee experiences huge G-forces, but they're relatively predictable forces as long as the skis are carving smoothly through the snow. This builds profound neurological and muscular endurance.
But if it's so strong, why do they tear their ACLs so often?
Because the skier knee is very stable only as long as the world is stable.
Ah, I see.
The text points out the tragic flaw. If the trajectory breaks, if a ski catches an ice edge and suddenly violently twists the leg outward, there is zero time for the brain to react.
Well, no.
Because the knee is locked in an isometric hold, when the force suddenly changes direction, the load exceeds the tissue's physical limits instantly, leading to catastrophic multi-ligament lesions.
Like everything tears.
The ACL, the MCL, the meniscus, all gone in a fraction of a second.
Wow. So if the rugby knee is a tank that runs out of gas, the soccer knee is a sports car that wears out its tires, and the skier knee is a bullet train with derails.
Oh.
What is the ultimate evolutionary ideal?
Wow.
The text saves its highest praise, its most poetic language, for the dancer knee?
The dancer knee is framed as the absolute pinnacle of human biomechanical adaptation.
Why?
Its dominant quality is exactness, or, in the original French of the authors, justesse.
Justesse.
Millimeter-perfect geometric alignment.
A ninja. It survives by simply never stepping on the mine in the first place.
That is beautifully put. The dancer's knee works in absolute silence. It doesn't rely on brute, eccentric force to absorb chaotic impacts.
So what does it rely on?
Instead, it utilizes absolute mastery of that feed-forward anticipation we discussed. The dancer's brain predicts every single landing flawlessly before the foot hits the stage.
Incredible.
Co-contraction is perfectly timed. The bones align perfectly so the weight falls squarely through the center of the cartilage rather than grinding on the edges.
I really want to highlight a quote from the text here because it offers such a profound philosophical contrast. The author's right. Force protects the knee against the load. Grace protects the knee against the error.
And in the reality of human biomechanics, errors cost far more than sheer weight.
Explain that.
A 300-pound Olympic powerlifter can squat massive weight perfectly safely because their alignment is exact. The load is distributed perfectly.
Right.
But a 120-pound person stepping off a curb and twisting their knee inward by 2 inches, an error in alignment, can completely obliterate their ACL.
Just from an error.
Exactly. The dancer's knee is the evolutionary ideal because it is incredibly economical, it relies on neurological intelligence rather than sheer mass, and it is therefore highly durable over a lifetime.
This concept of grace leads right into what the text calls the clinical gaze.
Yes, Chapter 7.
Dr. Delong explains how experts actually assess a knee in motion. They don't just look at a static x-ray. They look at the person moving in spirals and diagonals. They look for the flow of kinetic energy. And my favorite part, they listen. The auditory clues.
The auditory gaze is fascinating. When a clinician listens to a patient walk, a knee that makes a loud, heavy slapping sound when the foot hits the floor is a joint in distress.
It's slapping.
Yes. It is failing to absorb the shock properly. The muscles are firing late, and the bones are taking the brutal hit of gravity.
But a silent step.
A silent step means the feed-forward mechanism is working perfectly. The minutiae, the muscles, and the brain are actively, softly dancing with the floor.
It's graceful.
The silent step is the ultimate proof of neurological mastery. It proves the sensory system is closed, prepared, and operating without error.
Which brings us perfectly to the ultimate synthesis of our deep dive today. Dr. Delong and Kienjiga's formation end their incredibly dense presentation by giving us a blueprint.
A roadmap, really.
A roadmap for maintaining this vigilant slave over a human lifespan. They call it the architecture of durability, visualized as a pyramid. Let's recap this, building from the ground up.
All right, at the very base of the pyramid, the foundation, you have your passive structures.
The hardware.
This is your biological hardware. The exact geometry of the bones, the ACL, the menisci, the 7mm patellar cartilage. You are born with them, you cannot regenerate them, and you must conserve them.
Got it. And moving up one level, you add the software, proprioception.
Right.
Your joint's ability to use those Ruffini corpuscles to feel where it is in 3D space and send those high-speed telemetry texts to the brain.
Exactly. Above that, you have co-contraction, the muscular synergy.
The 1.5 to 1 ratio.
Yes, achieving that perfect strength ratio of your quadriceps and hamstrings, allowing them to fire simultaneously to create a protective muscular cast around the bone in under 50 milliseconds.
Then, near the top, alignment. The physical exactness,
Crucial.
ensuring that your hip, your knee, and your ankle track in a perfect geometric line to avoid shearing the cartilage on the edges of the condyles.
And finally, at the very peak of the pyramid, the crown jewel of joint health, neurological anticipation.
Feed-forward control.
The brain's ability to predict the physical future and prepare the knee before gravity even takes hold.
It fundamentally changes how you view your own body, doesn't it? The strongest knee isn't the one that reacts the fastest to a mistake.
No, it's not.
It isn't the one connected to the quad that can leg press 1,000 pounds on a gym machine. It is the knee that never arrives late to an impact.
The text summarizes this entire philosophy with a really beautiful triad. The strong knee resists, the fast knee survives, but the knee that dances almost never gets hurt because it is never late.
It is never late. Wow, what a line. That leaves us with a final lingering idea for you to mull over as we wrap up this deep dive.
Something to think about.
If the true secret to joint health, the secret to protecting your irreplaceable life capital, isn't muscle size, but your brain's ability to constantly predict the immediate physical future, what does that mean for how we train our bodies?
It's a vital question for anyone who wants to stay active into their later decades.
Should we really be spending all our time sitting on a padded, perfectly stable machine, doing mindless, repetitive leg extensions while staring at our phones?
Probably not.
Because that requires absolutely zero feed-forward anticipation. Or should we spend far more time challenging our brain's balance?
Navigating uneven surfaces.
Playing games of rhythm and coordination, forcing our nervous system to constantly calculate and predict.
You really have to ask yourself, are you training your joint to operate like a dumb mechanical door hinge? Or are you training it to operate like a vigilant, intelligent sensor?
I know how I'm going to walk from now on. The next time you walk down the street or descend a flight of stairs, just listen to your step.
Listen for the slap.
Is your knee violently reacting to the ground in a panic? Or is it already anticipating the floor, greeting it softly? Remember all the complex geometry, the hoop stress, and the neurological lightning happening right beneath your skin? Go out there, take a silent walk, and treat your vigilant slave with a little more respect.